It's the Talk to Me Network on AM 1510, FM 99.9, 94.7, and 100.7. The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
Hey, it's Dr. Lee Sheldon. Here we are at we're helping seniors of Brevard, and we are beginning this radio program. A little bit of technical difficulties. I know I'm supposed to be the guest, but here I am. I'm the host just temporarily. Today we are going to talk a little bit about dentistry, and we're going to talk about dental abscesses today. But first, let me introduce to you your host, the host of this program for God knows how long, Joe Steckler.
You better be quiet because I don't know if that guy...
We're on the air, Joe.
That's right.
Joe, we're on the air. We're on.
We're on the air. This is Joe Steckler, folks. I'm sorry about all that. We thought we were off the air. It's a good thing we didn't say anything, but all joking aside... we had the sound turned down in the studio. We couldn't hear our broadcaster. But this is Joe Steckler, your host for Helping Seniors. And, our purpose is to inform, educate, and connect seniors and those that serve with seniors to resources. And it's becoming more and more and more apparent with what the feedback we're getting from our media effort, our outreach, and our newspapers and everything that people are finding more of a need, and they're finding fewer resources to meet these needs, and that's the purpose of helping seniors. So we do it all through sponsors, and we have a fundraiser going, and there was a commercial on right before we started talking about our raffle of our 1951 Ford Victoria that A.J. Hires gave to us, folks. And that's right, he gave it to us from his own collection, just to help us raise money to help support our programs, because, we're still in the process of growing, and we need donations just like any other nonprofit charity. Our local United Way does not help us. The county commissioners have decided to cut off funding for nonprofits. So, it's amazing because there are so many people out there in need, and every time I go speak at a group, I find people, especially senior women, that were married to World War II men or Korean or Vietnam vets that are living on $600, $700, and $800 a month and are not even aware that they're eligible for Veterans Aid and Attendance programs, which in some cases are $1,100 or $1,200 a month. So this is in my book, folks, it's a crime. And when you have county commissioners that want to cut off a program that tries to inform people that there are benefits out there for them to help them live as they grow older. It just seems a real crime to me that we can't have commissioners that are more forward-thinking than that, or we can't have a paper that's more forward-thinking than that, and we can't have local people in our area that maybe want to feel a little bit better about supporting an organization. But
I'm a local person in the area. Give me some credit, will you please? You're complaining about, you got a guest here who's been supporting Helping Seniors of Brevard since when? Since it started, Joe. I'm right here, and you can build upon my enthusiasm rather than complain about, you've got me right here. You can ask me, what do I do? Why do I love you? Why do I love Helping Seniors of Brevard County? I'm right here. The listeners want to hear what I have to say, because I'm probably drowning them out right now, and they're saying, shut up, Lee. You haven't been on for 2 months, and now I know why you haven't been on for 2 months. Oh, I'm done.
That's right. You can double your membership for that now. That's it. All of you boycott Dr. Sheldon's implant office until he doubles his sponsorship.
Holy mackerel.
This is one way to get even.
Holy mackerel. Now he's boycotting me as well. And still, I'm a guest on this program.
Seriously, folks, we do have sponsors like Dr. Sheldon and the Bill Johnson, old law attorney.
I don't know if I can afford to sponsor anymore when I'm berated because I'm sponsoring. This is really tough.
Well,
but I think I can make it. All right, Joe, go ahead.
But seriously, Lee, it is people like you, like Woodstock, like our assisted living facilities, Senior Scene Magazine, Hometown News. They're all sponsors or in-kind sponsors, but they're all doing a job of helping us get information out. And all the panelists are, and just like you, we're going to talk about several subjects today. We're going to talk some dental stuff. We're going to talk about some weight stuff. We're going to talk about some nutrition stuff. But it's all important. And if you just look at the newspaper, or get your iPhone out, take a look at Smart News on your iPhone. There, almost every day, there's an article in there about nutrition in different countries. There's an article about healthy living. There's a talk about ways for local communities to help each other, but we don't pay attention to it. We don't give enough credence to the fact that there really are some countries, some people that need help in order to get to where they can take care of themselves. And that's a fact of life. It's not going to change. It's been that way for thousands of years.
Yep, it has been.
Yeah, and we can joke all we want to about it, but we are going to talk about some dental things today. But before we even do that, because I think this sort of impacts on dental business too, nutrition and overweight.
Yeah.
I just looked in Florida today in the last couple of days. One article in Florida today said that due to the fact that our president cut off the subsidies for the Affordable Health Care Act, that Health First is going to increase their cost of their Advantage Care plans by 39.8%. That's the average cost they expect to do, 39.8%. In the next day's paper, there was an article in there that said that 4 out of every 10 Americans was obese. 4 out of 10 was obese. Now, before the show, we were talking about this, folks, and Dr. Sheldon pulled out his phone and was looking up a definition, and it said on their definition that being overweight and obese are essentially the same thing.
Correct.
But I see people that, and I know definitely, I'm overweight, but I don't think I look obese.
No, well, then there's morbidly obese, I guess. I mean, they measure it based on body mass index, and if you go above a certain portion of the chart, and I'm sure I'm above it as well, then you're considered to be overweight. I think the bigger problem may not be the definition. The bigger problem is what you've talked about, and you and I have talked about this for years.
For years, Lee, I know.
It happens to be the junk that we call food, and particularly the junk that we call food, particularly in the United States, that we call food. I mean, so if you call it food, then it ought to nourish you. But if it doesn't nourish you, then is it really food? But we do it all the time, and whether we're talking about the fast food places or whether we're talking about getting things in the frozen food section or the canned section or stuff like that, is that really food? If you went to Italy, for example, I'll give an example of a country, and you see what they consider food and what we consider food, they're two different things. We've become victims, and I hate the word victim because it's our own responsibility, of what's easy and what's sold to us on TV. I mean, that's what it is. So if that's what we're doing, we're the ones that are responsible for our own obesity. If we decide that we need to have processed foods that come out of a bag of potato chips, we need to eat a lot of that, or we need to eat processed foods of any kind, we're responsible for our own obesity. So you look at the price of healthcare, and the price of healthcare has gone up. Well, that's also the price of laziness of the American population. Laziness, inattentiveness, thinking that you can do anything because the doctor will take care of any disease you have. All you have to do is take a pill. That's our society. And so, yeah, it does cost money for health care. It also costs money for all the legal things that need to be done that are associated with health care, to cover a doctor's back, to cover a hospital's back because they're getting sued left and right. There's a whole lot of things that are involved in this thing that we call health care that probably have nothing to do with our health at all.
Yep. And I've come to think more about this business. You and I have talked over the years about prescription drugs and medications and how good, healthy, wholesome foods can do the same job as a lot of medications can. And I agree with you, but I've got a hold back on it because for my whole older senior life, I have been plagued with the gout.
Yeah.
And my wife cooks very wholesome meals. And Terry's a good cook. And we don't eat a lot of fat foods or anything like that, rich foods. We eat pretty simple foods, and because we both believe in that, and a lot of us fresh. But I still am prone to the doggone gout, and
it's true. That's and I'm not saying that you're going to eat healthy and that everything is going to go okay. It's not. I've just spent some time with a doctor in Vero Beach, Michael Mattice. And Michael works with the Cleveland Clinic. You know, Cleveland Clinic is a very, very famous diagnostic clinic.
Yes.
Well, you and I have talked about this before, and that is that inflammation is what we're keying in now as being the source of most of our chronic diseases. So it's inflammation in the body. Did you know that with saliva and blood testing, there are 30 different measures of inflammation in the body? I didn't know that. You know, we think of two. And the one that you see, or the two that you see most often, if you look at your blood test, are homocysteine and C-reactive protein. C, the letter C, reactive protein. So ordinarily in our blood tests, we're only getting 2 measures of inflammation done, yet the Cleveland Heart Clinic has come up with 30 different measures of inflammation. So essentially what this doctor is doing, and he's doing it, and there are a few doctors in the state of Florida do it, not very much, is to tailor the care that he's doing for the patient based on fine-tuning all 30 of those measures of inflammation, if in fact the patient has measures of inflammation, in order to be able to improve the body's ability to heal. So it isn't just basic nutrition. I'm talking about basic nutrition is responsible for obesity in this country. In terms of treatment, you still need doctors to treat, but it may be that the way that we're being treated, or the way that we're choosing to be treated, which is primarily with drugs, and not necessarily measuring all of the factors of inflammation that are important and that a major institution such as the Cleveland Heart Clinic has already developed. Maybe we're just not looking at the right thing. We may be looking at procedures. We may be looking at, as doctors, covering our backs, but not necessarily looking at the things that may help you and may help me.
Well, let me give me an example. And this is, I think, you know,
I'll give you a good example.
This is something that happened to me yesterday. I pay very careful attention to my health, and I've never hesitated in my newspaper columns or on the radio or TV shows to let anybody ask me a question about what I was doing or how I was reacting to a medication or anything else like that. But over the last 3 or 4 weeks, I have really been bothered by the gout to the extent that I can hardly walk.
Yep.
And I told Terry at night, sitting there, I don't feel good, and I have a pacemaker. So yesterday I had my pacemaker readout, and the lady that read the pacemaker, they did a readout, and she asked me a couple of questions. I said something, and I said, is the readout all right? She said, yeah, but she said you got certain days you had more activity. Well, then the doctor took a look at it. And what had happened was that in order to try to reduce the inflammation from the gout and the acid crystals, they were trying to use a low dose of prednisone to slow that down so they could get me on allopurinol to prevent the gout. But at the same time, what that prednisone did was elevated my blood pressure, and it exacerbated the problem in the bottom chamber of my heart to where the pacemaker reads all this and keeps a record of it. And so every time they look at my pacemaker, they look to see what's been going on. And the doctor who read the pacemaker said, Joe, what the problem is, he says, you're on prednisone, and it's caused your blood pressure to go up because my blood pressure is usually pretty good. And so they took a look at my medications, what I'm allergic to, and there's a limit as to what they can give me in terms of blood pressure medication, but they knew they had to get my blood pressure down so that it didn't exacerbate the problem in the lower chamber of my heart from the pacemaker. Right. So, you know, we don't know those things unless we're going to our doctor and getting a regular readout of the devices that they have put in our body. And to me, it's really important for people listening to the show to pay attention to what the body's telling them, go to their doctor, and learn to ask questions.
Well, I want to take it deeper than that.
Okay.
Because while I agree with you on the surface, I don't really agree with you.
Okay.
It's because if we're looking at pacemakers and we're looking at medications, essentially we're treating symptoms. We really are. What caused you to need the pacemaker to begin with? What caused you to have the gout to begin with? And we're used to doing exactly the same things that you're doing. So, listeners, I want you to go to a website, human.com, but it has two N's, HUMANN.com. And look at the research and the data that's there. You talk about high blood pressure, for example. Now, your high blood pressure was secondary to taking the prednisone. I understand that.
Yeah.
But if we look at the number of people who have essential hypertension, in other words, they have hypertension, they don't know why, but they take antihypertensives, pills, in order to get their blood pressure down. There's a lot of evidence in the literature that shows up that a particular chemical, which is inherent in the body, called nitric oxide, actually may be the source of hypertension in our bodies. And that if we have too much nitric oxide, that in fact our blood pressure will go up. And there are ways, we have too little nitric oxide, our blood pressure will go up. And there are ways, natural ways, to supplement the nitric oxide that we should be having all along, which may reduce our blood pressure. So that we're not taking... Let's assume that you're deficient in nitric oxide, and as a result of that, you have high blood pressure. So therefore, you're taking a pill to bring down your high blood pressure, where really the problem is a deficiency in nitric oxide. What would you treat first?
Nitrous oxide.
Of course. So there are discoveries that are being made, and by the way, nitric oxide is cheap. You can't put a patent on it. I suppose you can make a little pill, but it's a supplement. It's not something that's a medicine. And so it isn't like the drug companies that cost millions of dollars just to do research to market a drug. You can't do the $1 million of research in order to be able to market nitric oxide. It's cheap, it's easily available, and you can get it in forms of pills or something that goes under your tongue or whatever it is in order to be able to supplement that. You see, we're still involved, and we can talk about the food argument, that we're sold food. You know, we're sold the idea that we can have a quick, easy meal and everything's going to go okay. And we're also sold drugs. And we're sold drugs because that's what makes it easy for us. We're sold drugs because that happens to be the standard of care in medicine in the United States. So you don't necessarily have to stay with what the conventional medical wisdom says. You can look and you can explore for answers. And if you're looking at an organization such as the Cleveland Heart Clinic, which measures these 30 forms of inflammation, then you got to go back and you say, all right, is my doctor measuring those 30 forms of inflammation, and is he helping me monitor those? Because if he does or she does, maybe I'm going to feel better. Maybe I'm not going to have the symptoms that I have. See, it's a different level of medicine entirely.
Oh, yeah. But at the same time, when we talk about, there are people that have other conditions that do require certain medications to help with the problem that they have.
Do we know that?
Well...
Or do we know that these medications were developed as a temporary fix while you're trying to get to the source of the problem? That's the reason these medications were originally developed. Most of these medications said, okay, you got a severe problem, we're going to develop a medication, we're going to take care of that problem. And in the meantime, let's get something else taken care of so you don't have to take the medications anymore. Instead, we're taking medications every single day, and we think we need to take it for the next 30, 40, 50 years of our life because we never get to the source of the problem to begin with.
Okay, I understand your argument. I do. But take a look at it from my viewpoint. And a lot of people are listening that have high blood pressure. We don't know why we have it, and sometimes when they discover the high blood pressure, if you have some other problems, you've got to do something to get the blood pressure down. You know that.
Absolutely do.
Right.
Correct.
So in my case, this is what they're working on, and of course, I'm thankful that the doctor that installed a pacemaker saw what the prednisone was doing to me, and she said, "What we have to do is control the blood pressure until you get off that prednisone." Because she said, "I can't let your blood pressure keep going up, so we'll do this. You're already at the limits on these things, but let's use something that won't affect you that much. There's no side effects." And that's what she was trying to do.
Correct. I'm not arguing with that point. I'm not arguing against the chronic point. I'll give you an example because I can talk about it in your own life because you've already shared it on the radio. Look at what happened when you took that particular medication. Just last year, and how you were down for such a long period of time.
Oh, yeah.
And then you had a PhD pharmacologist go back and look at all of the parameters of that medication, what that medication could do to you, that you didn't know about yourself.
Right.
And whether you needed it. You see...
Hell, I'm going to say the drug lyric. Be careful.
Okay, but how many people will go that deep to figure that out? And how many people would even know a clinical pharmacologist to really look at things that deeply? I have a lot of respect for the medical profession, but I also have a lot of disdain for the medical profession when things are too simplified. And frankly, I have disdain for the medical profession, not really, because there are financial pressures that are put on every doctor in order to be able to get a patient in and get a patient out, so the physician doesn't even have the time to think anymore if he wants to make a buck. And I'm not saying you make big bucks just to make a buck, just to make a living. You see, we've created a system in this country that isn't necessarily conducive to health care. It is conducive towards getting rid of symptoms of disease. That it's good at. But in terms of real health care, that's not what we have in the United States.
But Lee, when you and I are talking today, the people that are listening to this show, if they are so fortunate to have a doctor, a physician that they go to that talks to them in terms of the way you and I are talking on this radio show today, they are very, very fortunate if they have a doctor that looks in depth at their medications and says, well, this could trigger this if we did this, and I don't really want to do that. Does that make sense?
It does. I just don't think that we're going deep enough when we do that. I don't think we're going deep enough when we do that.
And part of the problem is they don't have enough damn time to do it.
Oh, yeah, and part of it is they don't have enough training to do it. If I, as a doctor, get training from a pharmaceutical company and I'm told that this drug will do this, and that's as far as I go, tell me.
You're not going any further.
That's right. Or I may choose not to go any further because, frankly, I can get this done easily.
Okay.
And
well,
I hear the music.
We're up against the half show break.
Let's talk more about dentistry.
We'll be back in about 2.5 minutes, folks. Do stay with us. We're going to get a couple other interesting things we want to talk about. I want to talk about nutrition just a little bit, and I want to talk about the problems that abscesses can cause in your mouth.
We're never going to talk about abscesses.
That. Stay with us. This is Joe Steckler, folks. We're back live with the second half of Helping Seniors. The purpose of Helping Seniors is to inform, educate, and connect seniors and those that help seniors to the resources that they need to take care of seniors. Our information specialist, Kay Kaiser, at the office, her phone number is area code 321-473-7770. And Kay can help you get connected to some kind of a service that will help you with your problem. We are getting increasingly more calls, folks, from people that don't even know about the Meals on Wheels program. Kay has been referring a number of people to that program, as well as other programs managed by Aging Matters, who gets the largest share of federal dollars to provide care services here in Brevard County. And it's important that you know about these services that are available for you to help you live your life. That's why these services are provided. So call Kay at 473-7770 and ask her a question. We have a number of really, really super organizations that help us provide this. Some of them are Vitas Hospice, Seniors Helping Seniors, Courtney and Braswell Financial Group, Barbara McIntyre, Home Equity Specialist, Canadian Medications, Ear Care. Veterans Realty of Brevard, In-Home Personal Services, Care Patrol. There's just a whole slew of organizations out there, folks, that provide services that can help us stay in our homes safely and for a long time. And I know that I've mentioned several things that I picked up on the Elder Law Attorney Network, that whether we want to acknowledge it or believe it or anything else, if we don't take better care of our bodies, more of us are going to go into assisted living facilities and nursing homes. And right now, there are places in the United States where nursing home care, good nursing home care, costs $97,000 a year. And that's not Joe Steckler's figures. That's the Kaiser Foundation. $97,000 a year.
You know, I've always heard that it's cheaper to stay in a Holiday Inn.
It is. It is.
Or go on a cruise.
But you're not going to get the services you need. You might
I'll go get all the services I need on a cruise. It's fine.
Yeah. But Lee, when we were talking about it, there was another thing.
I know I'm joking around.
I know you are.
You know, I've insulted everybody today. Joe, you're just bringing me down. What can I say? I mean, got all these problems. $97,000 a year. We've got gout. We've got problems. We got obesity. We got nutrition. Maybe we'll even talk about dental abscesses. After all, I am a dentist.
I know that. We're going to talk about that. One thing first.
Well, wait a minute. Joe, so far we've been in the show for, let's see, it's been roughly 30 minutes. I'm a dentist. Do you ever have any physicians on this program?
Yes.
You do?
Yeah.
Do you talk to them about dental problems?
No.
Oh, okay. I just wanted to say. Just checking.
Okay, what is a dental abscess?
What is a dental abscess? I'm glad you asked that question.
What is it?
He saves all the special things for you, Lee.
Hey, Gary, isn't that nice? Yeah, should I be a guest on the show every week, do you think? And
it would bring joy into my life.
To bring joy into my life, too. Thank you.
Okay, if you got a dental abscess, why can't you just stick a needle in it?
Because you'd get infected and then your teeth would fall out. That's the short of it.
You don't need me. You got Gary. Why do you ask Gary the question? He's right. But I got a patient who keeps on sticking a needle in his, and he says there's got to be some solution. He's over 90 years old. He's got to be a less barbaric solution to extracting your tooth. And unfortunately, it's been going on for so long that the only option we have is to extract the tooth. And he keeps on sticking a needle in it, which may not be very good because that needle may not drain everything out. Listen, you get a dental abscess for a couple of reasons. Number one, you've got the inside of the tooth that has a canal. It's called the root canal. And I know we in dentistry are so stupid, we call the procedure where we remove the nerve of the tooth a root canal as well. So we've got the same name for both the procedure to take care of the inside of the canal as well as the canal itself. Anyway, you got a hollow tube. It's filled with nerve tissue. That nerve tissue dies for a number of different reasons. When that nerve tissue dies, it gets putrid. It gets smelly. It gets pussy. And it squirts the pus right out the end of the root into the bone, and then it starts to swell. And that's called the acute dental abscess. Then you've got a nerve that dies, and it slowly produces bacteria to the end of the root. And you say, I don't feel anything. And sure enough, the dentist takes an x-ray, and he sees a dark area at the end of the root and says you have a dental abscess. And again, you say, I don't feel anything. But anyway, it's due to dead bacteria. At least this form of abscess is due to dead bacteria on the inside of the tooth. And bacteria has to drain. It drains out somewhere. It drains out at the end of the root and produces bone loss around the tooth. That's one. Second, dental abscesses are around the side of the tooth. It's called a periodontal abscess. It's trapped bacteria that's trapped between the gum and the tooth itself. And the bacteria stays there for a long time, and then it balloons out and you get swelling of your gum tissue. That's called the periodontal abscess. If you catch a periodontal abscess early, you can clean out that bacteria, and you can actually get that area to heal. Sometimes you need to go on antibiotics too.
Can you have an abscess and not know it?
Yeah, you definitely can have an abscess. The periodontal abscess, you'll always know it because you get swelling. But the one where you've got the bacteria in the canal and that bacteria slowly drains, yeah, you can have an abscess and not know it and then discover it on an x-ray.
So how do you detect that?
You need a smart dentist. I mean, a dentist who's really superb, all you need to do is take an x-ray. You can figure it out. Now, sometimes you don't see it on an x-ray because x-rays are only two-dimensional. And sometimes that abscess can be trapped behind the root and you don't see it on the x-ray. That's where a CT scan is really useful because on a CT scan, we can look at the root in all dimensions and we can see the abscess that way.
So, how many dentists would you estimate in Brevard County have a CT scan capability?
We probably have probably 15 or 20, I would imagine by now. It's become more and more popular.
It's become more and more popular.
It has because, a new technology comes into being. It becomes very, very pricey. Of course, that's when I buy it, when it's very, very pricey. And then, more of them are developed, and you can develop them, you can manufacture more at a cheaper price, and so, therefore, it becomes a lesser expense. It still costs anywhere from $75,000 to $100,000 to buy a CT scan unit. But given all of the things that we need, orthodontic treatment can benefit from a CT scan. Dental implant treatment, as you know, can benefit from a CT scan, as well as diagnosis of some of these abscesses and things like that. There become more and more reasons why we have dental CT scans and why they're more essential to dental care. They will be the standard of care. I can't imagine we're going to go too many more years before it's almost going to be a requirement to have a CT scan.
From a layman's viewpoint, think of this in our lifetime, yours and my lifetime. Let's go back, say, over the last 50 years. 50 years ago, to go to the dentist, generally speaking, it was for to get a filling.
Yep.
And they had a drill, and sometimes it was a 10-foot drill.
Yeah.
And it wasn't a high-speed drill.
No.
And they bored that tooth out and put a plug in there, and you went on your way.
Sounds disgusting.
But, that's the way it was.
It's true.
We didn't have X-rays then. We didn't have CT scans. We didn't have.
Well, we've had X-rays. We had X-rays then. We didn't have CT scans then. We had X-rays then.
Did we use X-rays?
You've had X-rays your entire life, yes.
I just don't remember them that much. But I'm thinking about the simplicity that dentistry was and what we're doing now. We have. And people are wondering, just like the cost of medicine, the cost of dentistry has gone up, the cost of medicine has gone up, but you hit a key thing. If you're going to do a CT scan to find out what the problems really are and how much of your jaw and everything else is affected, you're up into $100,000, and the dentist buys that thing, he's got to pay for it.
You're right, and patients who don't want that service, they can go back to the services they had earlier. So don't forget, if we're talking about 1950s, 60s, 70s dentistry, and even now, the answer was, as soon as there's a problem, just extract your teeth and put in dentures. That's cheap. You can still do that.
Do people still do that?
Oh, of course. You've got denture clinics. You can look in the phone. I was going to say look in the phone book, but yeah, you can still look in the phone book, and you'll find denture clinics that are here, and they do it at a very reasonable rate. Take out all the teeth, put in dentures, and you're done. Now,
but of all the people that get their teeth pulled and have dentures put in because they don't want any problem. What percentage would you estimate of those people who get that done could spend maybe, say, $10,000 and get their mouth fixed to where they wouldn't have to do that?
Probably a lot more than you'd think. Yeah. I've been in two different practices in Brevard County. One was the practice where it was a referral practice, and one was the practice where I see patients directly off the street. Okay, I'm seeing more severe problems when I see patients directly off the street. They're looking for help and they haven't been able to get help otherwise. But I am discovering that there are some patients who could be treated for far less than $10,000 and keep their teeth when, in fact, they thought otherwise. So there are, but if people are going to chronically eat sugar, and sugar rots teeth, and I have a lot of sugar eaters that come into my practice, then even if I took those teeth and I repaired them in the best way that I can, that sugar is going to undermine any repairs that we do, crowns, bridges, anything we do.
Oh, yeah, you say, okay, sure. But let's say if they come in and they have a problem, you correct the problem. If they don't eat sugar anymore, it's not going to, or is the fact that they've used the sugar going to make whatever repair you do not effective.
No, if they stop using the sugar and they're not doing other things to make their mouth acidic, like taking a lot of medications, because medications dries your mouth out, and your mouth becomes full of acid, and the teeth will rot away. As long as we don't have that, and the pH or the acid level is normal in the mouth, then yes, we can repair teeth, and they will stay for a long time. So I had somebody yesterday. Somebody was in yesterday, and his teeth. Actually, they weren't rotting away nearly as much as I thought they should be. He drinks 11 Cokes a day, so he's trying to help himself by cutting down from 11 Cokes to 10 Cokes a day. You see, that's what I see on a fairly regular basis, which goes back to the first part of the show where we talked about nutrition.
10 Cokes?
Yeah, 10 Cokes. Or, if I'm cutting out Cokes, but I'm having sweet tea instead, or I'm having Gatorade instead. All of these are sugar-containing products, which are not only going to rot away teeth, they're certainly not going to help the rest of your body either in terms of inflammation, like we talked about at the beginning of the show.
Well, as much as I hate to admit it, I need to drink more water. I know that.
All right. This was not a public inquisition of Joe Steckler. That wasn't the reason
I know that because, okay, let's go ahead, and you'll know more about this, but just as a layperson, I have the gout. It's caused by uric acid in the urine, and it forms the crystals in the joints, and it hurts like hell.
Yeah.
Now, if I drank more water, would that dilute my urine so that there'd be a less tendency for the crystals to form?
I'm not going there, Joe.
I mean, would it?
We didn't even put a disclaimer at the beginning. The views expressed by the hosts and callers, and also the guest who knows nothing about the answer to your question, is only your opinion, and please check with your doctor about anything that I've said. Okay, anything that I've said in this hour. The answer is I don't know. I don't know if just drinking water would be enough. I really don't.
I'm going to ask my doctor that because I really want to know.
Yeah.
Because we claim that 8 glasses of water a day is so we should all drink.
Right.
And I guess I know some people that drink 8 glasses of water a day,
Not very many.
Not very many.
No.
Do you?
No. I don't.
And here we are talking about dentistry, talking about nutrition, we're talking about gout, we're talking about all this stuff. I guess when we go to the next life, Lee, we'll wonder and be able to look back and look back and see all the stupid, dumb things that we did on this earth that caused us to have problems and how simple it might have been to alleviate those problems.
Maybe we could have a next life without a body, and then we'd be just fine. It's the body that's screwing us up.
Okay.
You want to get into a religion a little bit now? We've already covered medicine.
No. I got a couple of other questions I really want to ask about here.
Oh, we're going to get back to the mundane. Now we're finally going to get into dental care. Good. All right, so dental abscesses.
I've been on the subject of abscesses because on board ship, I was on a submarine and that
was a ship, S-H-I-P, ladies and gentlemen.
Yeah, but we'd get on. We'd have crew members that would develop abscesses, and we carried the lance kits and all that stuff. We're at a hospital corpsman. We could do that.
Yeah.
But we didn't have dental drills or anything like that, so we had to be very careful what we're doing. But if a person has an abscess and you don't do something about it, what are the dangers of that?
Well, I've seen it happen, and unfortunately, people will let things go. So let's assume you have an abscess or a trapped infection below the gum line or at the end of the root, and it happens to be right adjacent to your sinus. And by the way, your back teeth on your upper arch are right adjacent to the sinus, at least for most of us. Then you can put a hole in your sinus.
Yeah, I'm feeling it. You can put a hole in your sinus.
Just put a hole in your sinus. And there are plenty of people who have sinusitis and feel like it's coming from their teeth. Well, it goes in the opposite direction. You can have a tooth problem that causes sinusitis. Study done in Pennsylvania probably about 7 or 8 years ago that looked at failed sinus surgery. Okay, so people have sinusitis. They have failed sinus surgery. They have sinus surgery. It doesn't work. So what do? They went back and they looked at the CT scans that were done before the surgery. And instead of looking at the sinuses, they brought those CT scans down. They coned it down. Instead of looking at the sinuses, they looked at the tooth roots that were attached to the sinuses. And most of them were infected. The dental problem caused the sinus surgery to fail. And all they had to do was go back and take care of the dental problem, which would usually be by extraction or sometimes a root canal. And now the sinus succeeds. It's a big source of misdiagnosis.
So when we're talking, you use the word misdiagnosis.
Yeah, well, misdiagnosis or a missed diagnosis. In other words, you've got a sinusitis, and we assume the sinusitis is coming from the internal aspect of the sinus itself, or the areas where the sinus drains, in the particular areas where the fluid in the sinus drains, and those are blocked up. That's the assumption. But if the cause of the sinus inflammation is the tooth, then you can do whatever you want to the sinus. The tooth is still forming fluid and forming pus, and is causing the sinus to become infected. Unless you get to the source of the problem, it's going to continue.
As a dentist, though, you're very much in tune with what we're talking about today. But get into the business of. I had a family member that was an eye, ear, nose, and throat specialist. A doctor.
Yep.
What is the correlation between a doctor who is an eye, ear, and nose and throat specialist as opposed to a dentist when you start looking at throat problems, sinus problem, throat problem?
Oh, there are several times when we work together. I do work with ear, nose, and throat specialists, one in particular. And when we have a combination problem where we have a dental problem which is causing the sinusitis, then there's a cross-referral. I'll make the referral over to the physician, and sometimes the physician will refer to me, and we decide who's going to treat what first. You don't have to look at it and see what the cause is or what we think the cause is. Usually, if it's a dental cause, we'll treat the dental cause first, and sometimes that makes the sinusitis go away completely. Sometimes we'll treat our portion of the problem, and still the sinusitis continues, so then So the ear, nose, and throat specialist goes back in and does his or her thing.
How long is that type of cooperation between doctors been going on for a long time, or is that something? I guess what I'm asking is, in the field of medicine, how difficult is it for different disciplines to understand the cause and effect relationship of one discipline upon another?
Yeah, that's a good question. We've been separated for years because dentistry is just the mouth and medicine's the rest of the body, and somehow they became separated. I think we're closer and closer together now than we ever have been before. Not the physicians get a lot of training in dentistry in medical school. They don't. But there is a close cooperation among the specialties with the oral surgery department. There's usually an oral surgery department in every training hospital. And so even if you don't get everything you want in medical school, by the time you get through residency, you will have some experience with dentistry and understand how dentistry can impact the body and how it can impact the sinus.
Okay.
We've already got good evidence that the periodontal bacteria that we have affects the heart and affects the kidneys and affects the liver.
I know, because as a heart patient, I'm aware of that. Yeah. But you have tried to take this a step further with you've gone through some international studies, seminars and things. I think you went to one in Spain.
Yeah.
And that was for a certain problem area, but as a result of what you've tried to get different disciplines in the periodontal field to work together over the last 6-7 years, and you've started some new programs, and you've tried to educate up-and-coming young periodontists with what you've learned over the years.
Yep.
Am I saying it the right way?
You're saying correct. Members of my organization, though, go from their 70s down into their 30s. It's very interesting. And they all have different problems. But we're talking about a practice management organization. I'm not necessarily telling them how to treat, although some of those are influenced by the way we treat as well, because, as you know, we do some fairly innovative stuff.
Okay. Now, in the field of periodontistry, how important have you been able to establish the cause and effect relationship of good nutrition? You've mentioned the advantage in using less sugar, but what other nutrition type factors should people, the average Joe citizen, think about with what they put in their body? And I'm talking in terms of mouth and overall body, weight control, obesity, what are some of the ways that a dentist, with your background and your training, would recommend to listeners to think about to try to make some changes that are reasonable?
Walk into your local food store. You know where the middle of the store is? You know, the place that has all the aisles and the shelves?
Yeah.
Ignore that entirely. Go to the outside of the food store, and that's where the good stuff is.
You're talking about fresh stuff.
Yep. That's it.
How about the one thing you talk about fresh things, but does the consumption of red meat products affect the nutrition or the mouth in terms of being able to control diseases in the mouth?
It actually can. If we look at, there are not a lot of vegetarian studies, but there are some with regard to vegetarianism and periodontal disease. But just look at it this way. Let's not talk about vegetarians for a second. Let's just talk about meat. If you eat something that is made out of meat, that meat is acidic and will produce an acid response in your body. When it does produce that acid response in your body, then, of course, your teeth can rot. Now, when you have decent saliva, you know, that saliva will buffer that acid, and you'll have a normal acidic, you'll have a normal or a neutral type of saliva. But as we get older, our ability to have neutral saliva is reduced. And so the more meat we eat, the more acidic the mouth is, the more the problem might be.
So one of the smartest things that I could do as a citizen would be the last thing before I go to bed at night is brush my teeth and get rid of all the stuff that's been on my teeth all day long.
That's a subject of a different show. No. Brushing the teeth every night will not take care of the ills. It will not take care of all of the abuse you've done all day.
Okay. No. Well, we'll discuss that on another show. That's one thing to talk about. But thank you, Lee, for being on the show today, and thank you, listeners, for listening. And please do think about the car raffle of the 1951 Ford Victoria, because we sure do need our listeners' help, and we need you to tell other people about what we're doing, because I would like to think that the work of helping seniors is going to continue. We'll talk to you next week. Bye-bye.